The war on opioids has seen a surge after surge since the late 90s, but 2020 brought one of our toughest years to bear, a record number of deaths exceeding 88,000. Helping us to understand this insidious enemy is Dr. Paul Christo, director of the Multidisciplinary Pain Fellowship Program at Johns Hopkins University. Thank you so much for joining us, Doctor.
My pleasure.
So is it really, I've seen some words kind of being thrown out there, shocking numbers and so forth, but is it really that surprising that we saw an increase during the pandemic?
Not particularly surprising. I mean, the pandemic was a very, very difficult, tumultuous year for everybody. And with respect to substance use, we saw huge numbers of those using these mind and mood altering substances, mainly because of the stresses related to the pandemic.
Right. Who would you say are the most vulnerable? Is there a certain demographic, age?
Well, what we've seen is actually it's broad. So we have adolescents, those that are say between the ages of 13 and 25 that seem to be at risk, and even older adults, not necessarily older adults and opioids, older adults and these stimulant drugs like cocaine. Rather, that might be more tobacco and alcohol related. So I think it spans all age ranges.
Okay. I'd love for you to give us somewhat of a history on this crisis because we've seen a number of surges over the decades, beginning with the late 90s. Is that correct?
Yeah, that's right. That's exactly right. So initially what we saw in the late 90s was basically opioid overdose deaths related to prescription opioids. So it was felt that at that time, too many physicians, too many healthcare practitioners were prescribing opioids to too many people. And unfortunately, they were overdosing on them. Now, what we've come to understand at that time is that it wasn't mainly just opioids. It was a combination of opioid plus, say, alcohol, or opioid plus these group of drugs called benzodiazepines. These are drugs like Valium, for example, Klonopin. So it was sort of a polysubstance problem at that time. Well, after the late 1990s, what we then saw was a transition to the use of heroin. So illicit drugs like heroin leading to overdoses and deaths. And over the last couple of years, what we're seeing now is this yet another transition, and this time, though, to synthetic opioids. For example, fentanyl is a big one.
Right. And fentanyl, like you said, that is a synthetic drug, and it is extremely dangerous, and it is more potent than any other of these drugs. Is that correct?
It is. So,
Up to 100 times stronger than morphine?
Exactly. 90 to 100 times stronger than morphine. Wow. So that leads to death very, very easily, within minutes if someone's using it, and they're often, say, injecting it intravenously. Okay. What we've also seen, unfortunately, is that fentanyl is being used along with other substances. So in other words, those that are selling these illicit drugs are, say, putting fentanyl into methamphetamine or into cocaine or into oxycodone tablets, thus leading to death.
Yes. I want to back up just a little bit because you were mentioning, and I won't even attempt to repeat how you pronounce that particular drug, but in the late 90s, oxycodone, which you just named, was one of the highest prescribed drugs. And some of those under the names of Vicodin. Can you give us some of the other oxycodone-related drugs?
Percocet, Percodan.
Which we've heard over and over and over again, right?
Right, we have.
Would you say that doctors are less willing to prescribe those drugs nowadays?
Absolutely.
Okay.
Absolutely. I mean, yeah. Well, not only those drugs. Really, I think a lot of physicians are reluctant to prescribe opioids now because of what was experienced in the past.
So are people getting them surreptitiously? Is that how they're getting their hands on so much of it now? Or are we seeing more of the surge in fentanyl use and things of that nature that has contributed to the number of deaths that we saw last year?
What we're seeing now is not deaths related to prescription opioids. That's what we saw that in the past. What we're seeing now are deaths related to these illegal opioids that are purchased on the streets. So fentanyl is legal. I mean, we use it in anesthesiology often during surgery. But what we're seeing here and what we're talking about are people who are buying fentanyl illegally on the streets.
I see. All right. Well, this is a good place to take a break. When we come back, I want to talk about your book, Aches and Gains, a comprehensive guide to overcoming your pain. We're going to be talking about that in 2 minutes. Don't go anywhere. Welcome back. We've been talking about the opioid epidemic and how much worse it got in 2020 after we did see a decrease over the course of 2017 and 2018. We've been talking with Dr. Paul Christo. He's the director of the Multidisciplinary Pain Fellowship Program at Johns Hopkins University. And we did see some strides being made in the fight against opioid addiction. 2017, 2018, and then we saw another surge, and particularly during the pandemic. So these illicit drugs or illicit ways in which people are getting their hands on fentanyl, why do you think people are so willing to play with fire this way, doctor?
Well, I think that with respect to the COVID-19 pandemic, that has led to an incredible amount of stress among a lot of people. And what we know is addiction takes hold when you take a drug with rewarding properties. It could be fentanyl, could be alcohol, could be tobacco, and you introduce it to a vulnerable person at a vulnerable time in life. Well, I mean, the pandemic has been incredibly vulnerable, or has led to a lot of vulnerability on the part of many, many people across the world. And as a result, they've turned to these mind and mood altering substances in order to cope.
Okay. Now, you have authored a book, Aches and Gains, as we've heard often, no pain, no gain. But it sounds like this book is more of a way for people to deal with their pain rather than turning to drugs or substances to alleviate that pain. So maybe you could tell us more about this book.
Sure. So the book is, as you said, called Aches and Gains, and it really features a lot of compelling real stories of people who've overcome their pain using different types of treatments. So traditional treatments, which may incorporate medications that are not opioids, integrative treatments like acupuncture, for example, massage therapy, mind-body therapies, as well as sort of intriguing interventional treatments like with needles, for example, injections, nerve blocks, even things like spinal cord stimulation that use small doses of electricity to reduce pain.
Interesting. You've also turned this book into a nationally syndicated satellite talk show, Overcoming Pain, called Aches and Gains, excuse me. But you talk about ways in which people can use alternate forms to alleviate their pain. But when you're talking about certain demographics that do find themselves purchasing these illicit drugs on the street, how do you get that philosophy to them?
Sure. I mean, I think that with respect to those people, those patients, I mean, well, if we're talking about substance abuse, mind and mood altering substances, I think that needs to be treated first. So you have to treat that before you treat pain. You know, interestingly, though, a lot of people who use opioids, right, have turned to opioids basically to use them, to abuse them, have done so because they have underlying chronic pain. So it would be great to target, underlying chronic pain first, and to prevent them from using opioids. But we can't always do that if they have, some type of substance use disorder and it's related to opioids. Well, what they can do is certainly reach out to primary care doctors if they can. The American Psychological Association has a website that's quite helpful. It locates practitioners across the country, counselors, therapists, psychiatrists who can link them to treatment.
And telemedicine. Telemedicine has become extremely important, especially for us here in South Carolina and other states that have a lot of rural areas where people have a difficult time finding their doctor, going to visit their doctor in person. So telemedicine, maybe you could just briefly tell us the importance of taking advantage of this service.
Yeah, very, very important. And, prior to COVID-19, actually, telemedicine existed, but to a very low extent. So one of the positives that has resulted from COVID-19 is that telemedicine is abound. This allows people, wherever they're located, rural areas, the cities, to link to primary care doctors, to counselors, to specialists, therapists, even to groups, like group therapy, 12-step programs that are so critical to helping to maintain sobriety and recovery.
And I'm sure people want to know if these services are free or if they are provided to those who are uninsured.
Well, the mental health services, teletherapy services can be free, right? I mean, it could be certainly covered by insurance. If not, then I think often they're offered at a reduced rate.
Okay, very good to know. Doctor, I want to thank you so much for joining us today with this information. Really important. And again, where can people find your radio program?
Oh, just go to www.paulchristomd.com.
Perfect. Thank you again.
My pleasure. Thanks for having me.
We're back after this.